So it's now going on over a month of quarantine. I have not left this apartment in over a month. There's no end in sight, basically. I saw today that over 645,000 people worldwide have tested positive for coronavirus, and over 116,000 of those people are in the US. So now we are the leading country of coronavirus cases, it appears. Funny because I guess some people in that building across from me know some people in this building, because the other day I noticed that people are posting messages to be read across the way, which is kind of funny. And then we recently got another Instacart order, which I was very happy to see that we got all but one of our items, because the way Instacart works is you choose your items and then you choose the backup item in case you can't get your first choice. So we got either our first choice or our second choice, and then only one item. I think it was beef that Danny had ordered, and they didn't have his first choice or his second choice, but that was the only item they weren't able to fulfill at all. And it was on what day was it? I think it was a Tuesday afternoon that we got our delivery, so I don't know when the grocery stores restock everything, but we were lucky enough to get a lot of our order. And it's funny because, I mean, we have a pretty good size side-by-side, not side-by-side, but like French door refrigerator with a pull-out freezer. And I mean, Danny got a bunch of frozen pizzas. So we couldn't fit everything that we had gotten in the freezer. So I had to remove everything from its packaging, stuff it all in there. I could not fit one more thing by the end of it. And then I took pictures of all the packaging so that we would know how to cook things, and then threw the boxes away. Of course, when we got the groceries in, you have to disinfect everything. So they came in paper bags, which I assume is like cardboard, which they say that coronavirus can live on up to 24 hours. And then everything was either like plastic or paper, which plastic I read that that the virus can live on for up to 3 days. So anyway, I get everything out of the boxes, put them up on the counters, because it's quite a process. Because first you have to disinfect everything. So I just took Lysol wipes to everything, wiped everything down, and then I wiped all the counters down that everything was sitting on. It was all put away. But of course my process, like, this added a new layer to it, because not only do I have to disinfect it now, but I have to check it all for damage. I have to check it, make sure that it's correct. I have to check expiration dates, because I've had many times in my life where there are still expired things left on the shelves. So I am very, very quality assurance oriented when it comes to things that I'm buying that are coming into my house. So that was a long process, because we'd actually ordered a lot, and we're not hoarding things, but we're just making sure that we're well stocked up, because it's hard to get delivery times for grocery delivery. It's hard sometimes to have things be in stock, because it might be a particular time where there's just a run on all the groceries. So you have to make sure that you have things to eat, basically. Danny sent me an article about a Amazon employee in the Kent fulfillment distribution center that's, like, I would say, I don't know, like 30 minutes south of Seattle, who tested positive for coronavirus. So supposedly there is a deep cleaning process that occurs in these fulfillment centers when they find an employee that has tested positive. Which is a little bit confusing, just because I did find an article that talked about Amazon employees and then the testing that they're doing. But I don't know if it's like all Amazon employees or if it's just certain areas within Amazon that they're testing. But I did find that I guess Amazon has so many different divisions. So there's Amazon Care that I think is relatively new. And I read that they're delivering test kits to employees and their dependents. But I don't know if that also includes warehouse workers. So anyway, there's supposed to be deep cleaning wherever the employee has worked, you know, figuring out how long they were there with their symptoms and things. I mean, it's to be expected, I guess. You know, health coworkers are getting sick. Some of them are dying. You know, it's just infiltrated everywhere. So you hope that that employee didn't package up your package, because I know right now, at least me, us here in our building, the people that live here, and probably in the majority of Seattle, probably in a lot of places across the country, we are ordering things online to avoid having to go out. So if it's coming to your doorstep, you know, you really need to be disinfecting as best you can. And then earlier this week, I read a CBS article that the World Health Organization is saying that the pandemic is in the acceleration phase. So what we're hearing, that it's going to get worse before it gets better, is very true, it seems. Because when I started doing these videos, which was a few weeks ago, because this is my third video, there were 130,000 cases worldwide, and now there's over 645,000. Because of course it takes time to test people and confirm things and get the data out there. So, but that's a lot of people, and the numbers are just increasing and increasing and increasing. I was watching Sabrina Soto, who is this, she used to have some shows on HGTV. I think she has other businesses within interior design and hasn't been on TV for a little while, but she does have an Instagram. I've been seeing her Instagram live. She goes live with her interior decorating friend, coworker who's currently living with her right now in quarantine. And she was talking about how she might have a couple shows in the works, but she couldn't talk about them. But she lives out in California, and you know, when they do Instagram live, you can interact with them. And today I actually asked her, because she doesn't have a ton of people. Like, I think any given time, no more than 100 people watching her Instagram live at you know. So if you comment, it's pretty good chance that she'll be able to answer your question. And today, she's talked about her favorite show is Golden Girls, and I posted, which Golden Girl are you? And I think she said she was a combination of Dorothy and Sophia, and her friend said that she was a combination of Rose and Blanche. And then I feel like I'm a Dorothy, maybe a combination of Dorothy and Blanche. They're my two favorite Golden Girls. And I thought it was really cool that she answered my question. But by that time, there was only like 40 or less people on her Instagram live, which I love that. They're, it's the word approachable, what I'm looking for, or just like accessible. Because of course, you know, these people that have much larger followings, or a lot more people in Instagram live videos watching at one time, you feel like you're just in a sea of people and you're never going to be seen. So that was really cool. But anyway, I bring that up because two reasons. One was really cute. She said her dad sent her a paintball mask, thinking that it was protection, and it does nothing. And so she was wearing it in one of her Instagram live videos, which was pretty funny. She has a really good sense of humor. But in another video, or it might have been the same video, she was saying that they expected that California would be under, you know, quarantine rules for a couple more weeks. And so she was like, yeah, okay, like I can live with my friend for a couple more weeks. And then somebody commented, we heard it was a couple more months. And she was just shocked and horrified. And I'm like, how do you look at the state of things with how massive they are and think that you're only going to need to be self-quarantined for 2 more weeks? Is that realistic? I mean, I'm thinking this could last the rest of the year, or at least to several more months. I mean, this doesn't look like it's slowing down. As I said, World Health Organization is saying that it's in the acceleration phase. This is going to go on for the majority of the year. from what I can see. I saw a Washington Post article that really described in detail about how a virus acts and what they're learning about how this virus is acting. And I want to pull up the articles because I don't want to forget the important points or the interesting points that I saw. Some of the things I knew a little bit about a virus, but this was a good refresher on how it behaves, what it actually is. So the title of the Washington Post article is "The Coronavirus Isn't Alive. That's Why It's So Hard to Kill." So I just have some highlighted points so that I'm not here forever because my husband is currently hiding out in the bedroom so that I can have some privacy to film this video. So in this article, they're calling it SARS-CoV-2, SARS-CoV-2, because it is related to SARS. It says that it typically degrades in minutes or a few hours outside of a host, but some particles can remain viable, and that's where they say that it can survive on, I say survive, it can last or still be viable, up to 24 hours on cardboard, and then on plastic and stainless steel for up to 3 days. And then they found, in 2014, they found a virus that was frozen in permafrost for 30,000 years that they were able to infect an amoeba after being revived in the lab. So let me just back up because there's some other stuff before in this article. So basically, a virus, it doesn't have a metabolism, it doesn't need to eat, kind of activates whenever it enters a host. The virus functions through us, so it has no cellular machinery of its own, and they become intertwined with our cells. And their weaknesses are our weaknesses because they're so intertwined within us. So this says that drugs that might hurt them could hurt us too. So the vaccines that they come up with have to be targeted and specific so that it is effective. And then viruses can evolve very quickly, and because of that, a vaccine that they could come up with, say today, might be different next week or next month or next year because they're always changing. So the vaccines have to change as well to be effective. So the article also says that the virus itself is working in our favor in that it doesn't want to kill us because, as I said before, it activates when it's inside of a body. So the longer that you can be alive, the longer it can thrive. And it's saying that the ultimate goal of the virus is to be contagious, so it, while also being gentle on the host, again, so that it doesn't want to burn out and kill everybody quickly, because then what would the benefit be of that? If there's nobody left to infect, it can't go on. And so this says that it's why highly lethal viruses like SARS and Ebola burnt themselves out, because they didn't leave anybody alive to spread them. And they gave an example of oral herpes, which, fun fact, not so fun fact, I actually am one of the majority of people. I think the majority of people do get cold sores. I get cold sores. I tend to get them like on the right side of my face, on my lip, above my lip, and then sometimes creeps its way into my nose. But I'm saying this to help anybody out there that gets them and doesn't know that there is medication, prescription medication that you can take, because I used to treat them as they came with like the messy creams, and it just made it look worse. And when you mess with it, it can spread and get bigger. So a coworker of mine once told me that he took something called acyclovir, or it has another name. I think acyclovir might be its generic name, but it is a oral medication that you take every day to prevent the outbreaks. So I've been taking mine since 2013, and I have not had a single cold sore on my face since then. So it is very effective. So trying to help you out there. if you have cold sores, ask your doctor about acyclovir, because I'm telling you, it changes your life. Anyway, about oral herpes. This says that it's been with the human lineage for 6 million years. So that is a successful virus. And so right now the coronavirus, COVID-19, is in it's replicating destructively, and that's why so many people are dying. And then this says that one day in the not so distant future, it'll be like just another one of the handful of common cold coronaviruses. Apparently the common cold is a coronavirus. I don't know. That circulate every year. And so that kind of reminds me of the beginning of all this, when people were saying, oh, it's nothing worse than the cold or the flu. Well, when it's new like this and it hasn't adapted to that level, it's destructive right now. But as there are more vaccines, and as the virus learns and adapts, it will one day be less lethal. But right now, because it's so new, it's a little baby, and it's just causing havoc everywhere. It's a Guardian article that talked about, I think, was it Italy? Let me see. Oh, the headline says Spanish minister says older people found dead and abandoned. That is so sad. And then later in the article, it talks about how, if you're found to have done this in your line of duties, that you will be punished within the full extent of the law. So people are just abandoning these people, and they're either found abandoned and maybe can be saved, or they're found dead. And can you imagine being abandoned and then people around you just being with dead people because you were abandoned? I mean, that is just horrifying to me, to anybody. I mean, so much depressing news. When I started reading about the record cases of the coronavirus in New York, I almost spiraled. When you're cooped up in your apartment, you read the news, you know how bad it is, but you're still in your apartment and you're separated from it, which you should be. That's what everybody should be doing right now. But I have asthma, and I've had asthma since I was a little kid. And so if I were to get this, it could be potentially fatal for me, because in New York, they're talking about how they're starting to have to do experimental procedures on these respirators to split them between patients because they don't have enough. So if you were to get the coronavirus and go to the hospital, there might not be enough staff. Staff is getting sick. There might not be enough ventilators if you have to go in a ventilator. And then what do? You can't breathe, you die. And that's horrifying. I have an almost 8-month-old baby, and I'm just horrified of her getting a regular cold or flu. As a new parent, you're just terrified of everything, and that would be horrific if she were to get that. So I almost had a little panic attack. Probably everybody has had a moment where they were like, shit, this shit is real. It's getting serious. Oh my God, what if I got it? What if some family member got it? What would we do? And then you see the state of things, and you're like, my God, I might not even be able to get help. And so you try and calm yourself, because panicking doesn't really do anything. But I paused because there were just no words, basically, to the extent of everything and how things don't really seem to be getting better anytime soon. Like the other day, so in my bedroom, we now have these mesh side rails for our bed. And I used to, we have a TV in our bedroom, a proper TV in our living room, but I was just using my Mac. I have a large Mac computer screen as a TV, basically. But now these mesh bed rails have obscured that vision, my view. And my baby she's happiest for longest when she's just crawling around our king size bed. So I'm like, look, I'm in this bed for hours, particularly during the week when my husband works, and I'm in bed with her to keep her happy, because not only is she happiest when she's in the bed, but she's happiest when you're near her, because if you leave, she screams. Can't have that. So now we basically go in shifts, basically being by her side constantly. And I'm like, look, I'm in this bed. I need a TV that I can see. So we ordered a TV off of Best Buy. Well, Best Buy now has a policy that they will not step foot into your house, building, what have you. And so I'm like, all right. Danny came down there with me because there was a delivery window. The first one we missed because I wasn't aware of all this. I just thought that they would bring it in, put it in the package room. Danny and I would go downstairs and get it. So we went down there during the second delivery window, and it was between 12 and 6. Well, they came around like just before 1, and my husband had a conference call at 1 that he had to be on. So we run down there in hopes that we can get it. They said they're going to be here. They said they're going to be here. We still don't see them. We still don't see them. I'm like, Danny, run up, take the baby, put her in her crib, get on your call. I will handle this. Hopefully the concierge will help me at least bring it into the package locker room. I have this cart thinking that it's going to fit on there, but we got a 65-inch because I had the idea that I wanted to have a movie theater in my bedroom. And I'm like, this shit's not going to fit on the cart. And then I'm like, I need somebody to come help me bring it in here. The poor concierge is in like a mask and gloves because his girlfriend's has like an autoimmune issue. And come to find out, there's like actual places on either side of the box that you can put your hand to. I could have basically just drug it in by myself, but he helped me carry it up, and it wasn't super heavy, but it looked huge. And the Best Buy people, by the way, they didn't stick around. They basically just left my TV out in the front of my building and didn't even have me sign for it, basically. I could have been anybody. We were able to get it up, and then I took a bunch of Clorox wipes, wiped it all down. What was my point in talking about this? Okay, it came back to me. Being downstairs, even just being in the lobby of my own apartment building, I felt like a cockroach that needed to run back into its hole. I just felt so exposed, and just like, because you could kind of feel the fear around you, and there were plenty of people, entering and leaving the building to get takeout, to go to their jobs, to go on walks, to walk their dogs, whatever. And, you feel like you're safe in the apartment, relatively, even though you do have packages coming in and out to keep you from having to go out. But I felt very vulnerable, even just being out in the lobby of my apartment. There was I don't know if you call it Cairo, KIRO 7, which is a local news station, that said that there was a USPS mail worker that tested positive for coronavirus. And the funny part about it was, I guess that the U.S. mail has different buildings for different types of mail. So they did say that it wasn't in a building where you would get like real mail. It was in, those bulk mailings that's so annoying. That's a waste of paper that you get. That's where they worked. And I was like, well, ain't that a bitch? So you get this mail that you hate, right? With a side of coronavirus. Like, you don't even want to be getting this. And it's like, how do you like unsubscribe from it, or how do you make it so that you don't get it? It's just like this mail that you don't want. And so it's just like, wouldn't that be a bitch if you got coronavirus from this bullshit mail that everybody hates? Then there was, I guess, the mask that people use. I don't know if it's a particular, I haven't done research on the particular kind of mask you need to wear, but apparently they're called N95 masks. And there was a New York Times article blasting a Seattle Target for selling them in their stores when there is a shortage within the healthcare industry. And Target called it an oversight and made sure that those masks got to the healthcare industry where they're sorely needed. There's another New York Times article that talked about a murderer, like how they were letting out murderers and other types of criminals due to health conditions that could make them susceptible to getting the coronavirus. And let me find that particular article. Said that the guy his last name is Vincent Barcia, had a cardiovascular disease, pulmonary disease, and type 2 diabetes. And as a result of his medical conditions and age, he was at high risk for severe illness or death if he contracted COVID-19. The Legal Aid Society, which represents indigent clients, argued that confinement of elderly and sickly inmates during a pandemic violates their constitutional rights. 103 inmates at city jails have tested positive for coronavirus. They plan to release 375 inmates this week. And then it says that Judge Dwyer felt that a jury should decide on the defendant's fate, not a virus. I don't think that they present a clear threat to the public, I guess, because of their age and their health status. I don't know where they're releasing them to. I don't know if they're just like letting them out or like if they're moving them somewhere that's more secure. I don't know that the article said. So yeah, I understand, like, even though they're the scum of the earth and this guy stabbed 2 girlfriends. One he stabbed to death in front of bystanders and it was all caught on a video. And when they caught him, he said something like, "Is she dead? I hope so." So yeah, scum of the earth, piece of shit. But even so, when they're housed, they still have rights, and you have to do the right thing. But I hope that they didn't just release him like out the front door, like, "Here you go." I'm hoping that they just moved them to a place where they can be better protected, even though they don't deserve to be. Still cruise ships that are in quarantine and having people die on board, which was pretty scary. And then, yeah, like I said, that there's a division. I'm just going down the list. Like, every time I see an article, something that's interesting, I put it into a note. So, like, throughout the week, it's just kind of in order as I find things. So, I did find more information on a GeekWire article that was an update about the first woman in Seattle to receive the vaccine, amongst other tech people who are volunteering. So her name is Jennifer Haller, and she's a veteran of the late Microsoft co-founder Paul Allen's Stratolaunch space venture. She's the operations manager for Atunli, a Seattle startup that uses machine learning to help debt collection agencies improve their recovery strategies. She said she's doing great. Her arm isn't sore at all, and it's even better than a flu shot. She feels lucky to be in a position where she can contribute to containing the outbreak. She's healthy at the age of 43, has a stable salary position that lets her work at home. Her children are aged 13 and 16 and can care for themselves. Her duties as a study participant don't go much further than monitoring her vital signs, keeping a daily journal, and checking in with Kaiser Permanente for a second shot and a few blood draws. So that kind of answers the question that I had in my last video of, like, how old are her kids? Oh my gosh, why would a mother volunteer for something like this? Well, she has the means, her kids are older, she's healthy, she wants to do something good, so it all makes sense. But there was a New York Times article talking about individual Seattle coronavirus impact stories. Some of them that I found interesting were, well, they were just talking about how momentous this time in history is. So this guy who is a psychologist who also runs with his wife a wedding venue on their farm in San Juan Island said, in 10 years, 20 years, 30 years, we will be asking each other, what did you do during the coronavirus? And how did you respond? Another person was talking about how, you know, years and years, decades from now, they're going to be talking about this time in history and studying it, and it's going to be taught in classes, and people are going to be like, again, talking about, you know, where were you when the coronavirus was going on and what was your experience? Which is another reason why I think it's pretty cool to do these videos, because it's kind of like a time capsule. Mental health professionals in Seattle have been overwhelmed. Julia Hitch, who is a psychologist and founder of Seattle Clinic, is talking about how she's seeing patients back to back. College students who are disoriented and depressed after their semesters have been canceled. She's doing video conferencing and working out of a spare bedroom that she and her husband share in a makeshift office. A big part of her practice is working with patients who are obsessive compulsive, who have obsessive compulsive disorder. Specifically about the ritualistic hand washing that they have overcome. And now with all this big focus on hand washing, they feel like they're regressing, and so they need help now. Tom Douglas, who's a really big chef around here, has tons of restaurants. He has had to temporarily close 12 out of his 13 restaurants. And now to interject a little bit of humor, not making light of this person's situation, but Homegirl has a degree in Norwegian and anthropology from the University of Washington. And do you know what job she has? She's a bartender. No shade to bartenders. It is a job, legitimate as anybody else. But bless you, what did you think you were going to do with a Norwegian anthropology degree? Just a little bit of humor. Go to school for whatever you want to. I went to school for legal studies. I'm a stay-at-home mom. I'm not doing shit with it. So, you know. But still, my opinion, go to school for something that you can get a job in. I don't know. I mean, school costs a lot in time and money, so I digress. It's 27, and she said that her greatest panic came when she wondered if she'd be able to care for her cats. And she says, I don't care if I have to go without coffee or food or sell my couch, but if I have to give away my animals, they're all I have, which is really, really sad. I mean, despite my previous comment about her degree choice, you know, you feel for people on a human level when they have to decide between, do I eat or does my cat eat? And I don't want to get rid of them because they're like my children, which I completely understand because I have 2 cats and they are like my kids. And of course, these videos wouldn't be complete without stupid shit celebrities are saying. So Jamie King, who was a model / actress, I think the last thing she was on that I'm aware of was some show with Rachel Bilson that I like, Heart of Dixie, that I watched for like a hot minute, and it just was like not my style. She was thanking the virus, and I kind of understand her sentiment. I think I understand where she was going there, but she just really took it a little bit too far. Basically, and this is kind of a sentiment that's been echoed by some other people as well, maybe not quite in the same way, but something that is happening right now with people having to stay home is it is making you refocus, do things you haven't been able to do in a long time, spend time with your family that maybe you don't get as much of, or you know, as you would like. So it is having people understand going without, who may have never gone without before. You know, you can't find supplies, you can't find food always, so it does make you rethink things and appreciate things more, but she took it a little too far. And almost being happy and thankful that it has happened. And I don't think that any of us are thankful that this is happening right now. Madonna, who posted a very bizarre video that I recently watched, I watched it today, where she's in a bathtub, a bubble bath full of like roses and bath bombs, calling it the great equalizer, and you know, talking about what's great about it is also what's bad about it, or, you know, it puts us all on the same level, and people are like, bless you, but people who are poor are suffering the most and dying. You know, celebrities are definitely very much out of touch, and I mean, I think that we all have a perspective that is our own, and if you're lucky enough to have everything that you need, you're not going to be suffering with like this at the same way that maybe a single mom would suffer, or somebody who's lost their job or being laid off is suffering, or we all have our different struggles, and you don't necessarily need to compare one to the other. But I think that celebrities, money and celebrity can get you a lot. And they are not on the same level as an average person. Have access to the same things. You're not able to provide for yourself in the same way. We're not all in the same level of quarantine of like comfortable, you know, basically. So I think that with celebrities not being able to work and having to be quarantined like the rest of us, they are taking to Instagram and they are putting their foots in their mouths, their foots in their mouths, their feet in their mouths, and I'm loving it. I'm here for it. Ironically, I don't know if they're still best friends. They have been over the years, but Debbie Mazar, who's on Younger, has COVID-19. So, and she's been kind of posting about how she's been doing. Prince Charles has tested positive for COVID-19. There's an actor, Mark Bloom, who I'm not as familiar with, but he died from the coronavirus. And there is coronavirus.gov website, and all the links take you to the CDC website. So if you have any, questions, they should be answered there. A lot of good information if you're not as familiar with what's going on, if you want to catch yourself up on what is going on, how to keep yourself safe, what to do if you think you have coronavirus. That's a good resource. All right, so I think that is everything. If I have forgotten anything, I'll just insert the screenshots at the end of the video along with any of the great memes that I've come across with during the week. If you come across this, if you like the video, leave a like, subscribe if you want to see more videos, watch some of the videos that I've already done, leave a comment, about anything having to do with the coronavirus, where you live, if people are taking it seriously, where you are in the country, if you're not in this country, how it's affecting you. Leave the funniest coronavirus meme that you've come across, or the most infuriating thing, any personal experiences, anything that you've seen in your neighborhood that you're just like, what? Behavior that you can't believe that people are displaying during this time. Just anything that is interesting, shocking, what have you. I will most likely be doing another coronavirus vlog next week. I'm gonna try and get my act together and actually post this tomorrow if I possibly can, just so that I'm up to date on everything. I hate posting things late because with something like this where things are developing hourly by the minute, I just don't want to be posting something that is so late that it's like completely irrelevant basically. So thanks for watching, and I'll see you in my next video.